Hi everybody, we've had a question from Catherine about how COVID-19 is likely to affect practice finances, and hot off the press we have the letter from NHS England on the 4th of August. So I thought this was a really good time to record a quick video about the COVID-19 support fund for general practice. Let's say it is off the press, so please excuse my looking down to have a look at my notes. So we have had reassurance from NHS England, particularly from Nikki Kahani, all the way through the process that general practice will not be adversely affected by providing the services that are required to keep our patients safe and well. It's obviously really difficult to know what that looks like, and it has taken a considerable amount of time to get the letter out, so much so that I think parts of it are now so outdated that you probably couldn't use them, but we'll go through the letter and have a look and see. It is obviously good to now have a really clearly defined claims process. A lot of CCGs have had to put interim measures in place to ensure that practices had good cash flow. So let's say we've got the letter from the 4th of August. I'm going to pop that into the link so you'll have the full detail. Thought it was worth summarising for you. So the letter outlines the funding that's available, and so the first cover is about the additional opening hours that we did on the bank holiday, and then that moves on to care home funding for additional services, COVID-19 related absence cover from day one of the absence, additional capacity cover, and then also providing consumable costs. So there will be full funding of PPE, and details of how to claim that will be following. The mechanism for payment is actually a Section 96 assistance and support for primary medical services payment, so it sits outside of the income guarantee. So the money in here is additional on top of the money that you've already been guaranteed that you'll still continue to receive even if you haven't been delivering local enhanced services or elements of the contract. And the claims process will be administered by your CCG. So in terms of the care home support, there is information in the letter. There's about half a page of what can be claimed. This is probably one of those areas where perhaps the letter is now a little bit out of date. A lot of it relies on gaining authorisation from your CCG before delivering the service. And now this service is available from 1st of May to 30th of September, so there's still some opportunity if you need to provide additional support to your care homes, have a chat with your CCG, but there's a clear expectation here that the commissioners should work with practices to determine how to secure this in a way that is appropriate for their circumstances. For example, this might be through commissioning a local scheme or through practices submitting claims for reimbursement for additional capacity. So there's definitely a sort of pre-approval from the CCG that this is the right thing for the area. Now the bank holiday opening, most areas have been paid for the actual cost of opening based on the staff costs that were sent out in the primary care bulletin back in April. But actually under section 13 here, practices can also seek approval to claim reimbursement for non-staffing related costs, such as facilities management charges, cleaning, utilities, etc. We were previously told we could only claim for staff costs, so it's nice to see that in there because of course there is an additional cost for opening for additional days. So probably one of the biggest claim potential areas is backfill for COVID-19 related absences. So the dates on this are the 23rd of March to the 31st of July. Again, it is about seeking approval from the Commissioner. Commissioners have been given an opportunity to approve all claims here. This isn't guaranteed from NHS England. The Commissioner does need to approve the claims. And the claims for staffing, the GP absences, first 2 weeks are covered by this scheme, and then it would move on to the scheme covered in the statement of financial entitlement. But importantly, actually, we've got backfill for non-GP practice-based staff related absence as a result of COVID-19, and that can be claimed from day one for the length of the absence up until the end of July, so no 2 week period on that. The requirement on that is it was necessary to secure backfill to maintain capacity where it's not being possible to cover the absence from existing capacity across the practice or wider system. The rates that are claimable are GP partners, £289 per 4-hour session, plus national insurance and pension costs. Salaried GPs are based on the amount that they were paid in February 2020. So those GPs must have been working for you before the 1st of March and must have had a rate of pay in February 2020, and you can claim their hourly rate plus national insurance and pension costs. If they have a different overtime rate to standard rate, you can claim the overtime rate, provided they've worked more hours for you. Locum GPs are being paid at a rate of £200 a session, £400 a day, or £250 a session if it was out of hours on the bank holidays. Again, you can claim national insurance and pension costs. If you used other practice staff members from the workforce, then again, this is subject to CCG approval, but they will be paid based on their current rate of pay. And if you used any temporary staff, NHS England expects that to be in line with the practice's existing contractual pay rates. The document does make provision for additional capacity that was required between the 23rd of March and 31st of July. Now, again, this is probably one of those areas where if you didn't seek approval, then you are going to be challenged on asking for this, because it says where a practice has required additional capacity over and above usual levels during the COVID-19 outbreak and it has been supported by the CCG, the practice can seek reimbursement for the additional staffing costs incurred. So there is an element of pre-approval in that line. However, I think if you have laid on additional staff members in response to the crisis, then you should be putting a claim in. We need to demonstrate the amount of money that has been poured into the response by primary care, even if that claim doesn't get approved. Underline paragraph 20, we've got reimbursement for other additional costs. So things like minor physical adjustments to the building, perspex screens and barriers as an example, additional cleaning materials, additional clinical equipment, pulse oximeters and thermometers, and then any other costs not covered by the list should be discussed with the Commissioner. If you did get additional cover and that involved employing a salaried GP on a temporary contract, the amount of money you can claim is capped at £200 a session or £400 per day. So what actions required by the practices? As part of the letter, there is an Annex B, which is a declaration form, which then needs to be supported with invoices for the amount of money that you are claiming. And there's a level of detail on each of the claim areas. But importantly, you need to submit this claim within 6 weeks of the 4th of August. So don't miss that deadline. The commissioners then are asked to follow their normal claim process, but they will be conducting a post-payment verification on a selection of practices. If they find that the claims are not in line with the claims process, then they will expand that. In Annex B, just a really important point here, you will need to provide evidence of your pre-COVID-19 locum capacity. So you'll be asked to provide January and February 2020's locum usage. I guess just to check that the locum usage that you had post-February was in response to the COVID crisis rather than your normal levels of cover. So yeah, full details in the letter. Wish you absolute luck with your claim. I know that particularly Nikki Kayani has been really supportive of primary care. It is a really difficult time with a lot of unknowns, but let's hope that if you pop your claim in, you provide enough information, then that will be approved. If you are struggling with any claims, then I'm sure there will be an escalation process to follow. Always keep in touch with your LMC. They will be able to provide you with the support you need. Thanks very much for joining me today.